Hello and welcome to Health Professional Radio. I'm your host, Neal Howard. Thank you for joining us today on the program. Our guest in studio is Dr. Charles Mahl. He's a former retinal surgeon whose practice was ranked number 40 in the nation out of 1,500. Now, following his own issues with back and hip pain, he entered into his second career in regenerative medicine. His specialties are pain management and using prolotherapy. He's here today to talk with us about one aspect of his practice, which is weight loss management. Welcome to the program, Charles.
Thank you, Neal. I'm happy to be here. Happy to be here.
Talk a bit about your background. I mentioned that you're a former eye doctor. What happened?
Yeah, that's correct.
Yeah.
Well, I went from eye surgery. I was forced to prematurely retire because I had lots of issues with my hips and my low back, some of which was hereditary, some of which was occupational, and I simply couldn't sit anymore for any length of time and do complex microsurgery. So I basically just plodded along with routine conventional orthopedic care and neurosurgical care and pain management. And then things got bad again on me, even after my retinal career, that I was looking for some relief of my pain in these areas, and I didn't want more surgeries. And discovered the words regenerative medicine and prolotherapy, learned all about it, sought out a competent physician experienced in the art and science of performing these treatments, and went through the treatments, and lo and behold, it really helped me tremendously, to the point that I was so excited about it that I said, I'm going to learn about this, because if I didn't know about it for 30 years as a physician, then there's got to be lots of people who don't know about it and who aren't being offered these types of treatments and who could probably or possibly be helped by them. So I spent over 3 years learning how to do it with one of the top orthopedists in the United States, who won the Lifetime Achievement Award at the orthopedic national meetings and whatnot. And after 3 years, I was competent and went out on my own. And from there, it's taken off, where I lecture all over the United States and Latin America and whatnot, and train and teach other doctors and take care of patients really all over the world. So from that, I got into not just the regenerative medicine, but obviously weight loss and age management medicine. And weight loss is one of the big things that we talk about, because often patients come in and they're in their 50s and they're 20 pounds overweight, and they go, Doc, what can I do? I want to lose my weight. And they're looking at me and they really want a pill. I could tell right away they want a pill. And I go, no, we don't have that. And weight loss is one of those things it's probably one of the toughest things to treat in a medical practice. If you watch TV late at night, it looks like there's 500 different supplements that one can take, and a quick fix to make you better and to lose weight, but it's not there. It's all it's an unregulated industry, these supplements, and very few of them really do what they're intended to do. But with that said, weight loss has about a 10% success rate in anyone's practice. I'm talking about losing anywhere from 20 pounds to 50 pounds or more. Forget people who need to lose 100 pounds or more. That's a different subject. But most people end up on quick diets. They lose their weight that they wanted to very quickly, and they're so happy that they start eating more, and then they gain more weight than they had before. And we see that probably 90% of the time. So my philosophy of weight loss is to do it slowly. Take your time losing weight and develop good habits of what you're putting in your mouth, and learning how to be sophisticated really and well educated as to what you're eating and the calories you're taking in, and that, if you do it over a longer period of time, you will keep the weight off and be a success. So that's really what I train my patients to do, which is calorie restriction. I tell them, I call it the pearls, these things we know about that we never do. And I also preface it by saying, look, nobody does this 100% of the time, but if you could do it 4 out of 5 times or 80% of the time, you're going to hit a home run and you'll be successful at accomplishing your goals, if you're serious about it and if you've made a commitment to yourself. And most people sometimes, unfortunately, need a life event to scare them into losing weight or doing the right thing, let's say stopping smoking or excessive alcohol. So hopefully, you can get to patients before they have that life event and and get them to do the right thing before that. And with eating, a few pearls that I talk about are when we all go out to eat, anytime you go out to eat, I go out to eat, it's known that when we're in a crowd of people eating dinner, 4 people or more, we tend to eat more. So I make my patients recognize that fact. So now that they're aware of it, they know that in a crowd they'll eat more, so they now know to eat less. I also train them to try and eat half of what's put on their plate when they go to a restaurant or when they're served something, because if you eat half of what's served to you, you're already getting half the calories. Now, the key to that is not being hungry and not craving food. And there really are very few supplements out there or drugs that can stop your craving for food without giving you side effects like a racing heart or feeling restless or not being able to sleep at night. So you really have to manage all these things on an individual basis with patients and go from there. But basically calorie restriction, not eating empty calories like cookies and crackers and things like that, and sticking to things that really, really work for you. Proteins, chicken, fish, occasional meat, vegetables, fruits. These are the things that we all know are good. They're not good when they're fried. Fried foods just are bad for everybody. So, again, these are things that everybody knows about, but do we all follow it? No. I love pizza. I'm guilty. I love a cheeseburger. I'm guilty. And it's not bad to have it all the time, but if you're doing it 4 or 5 times a week, you're going to gain weight, and it's tough to pull the weight off once you have it on you. So that said, I give my patients a 4 or 5 page brochure on all these little pearls, and most of them go, "Yeah, I know that, doc. I don't follow it, but I know it." And we laugh about it, and if they're committed, they start following it, and they start changing, some of the bad habits we have as to what foods we're putting in our bodies and keeping it clean. And it's the same thing as taking care of our car. We take care of our cars better than we take care of ourselves. We always, we know to change the oil in our cars. We know to put good gasoline in. We know to clean the car inside and out, but very few people really do it to their own personal bodies. So that's sort of how we talk about these things and what I ask my patients to do. And I get them involved in an exercise program. And again, my key to that is saying at least 3 days a week, 45 minutes a time. The more the better. Don't overdo it. Exercise does not make you lose weight, even though when you exercise you're losing calories. What exercise does is it tones up your muscles and gives you strength. So there's an emotional and a physical benefit from exercise, but the weight loss really comes from eating less. The less calories you put in, the more weight you're going to lose. And that's the key really to weight loss.
Is it always about weight loss? In your experience at GenLife, do you ever encounter patients who simply want to manage weight or perhaps gain weight so that they can attain a healthy weight?
I've had patients who come in who have minimal muscle tone, and in the process of eating healthy and working out with a competent exercise program, they gain weight because they're gaining muscle. And usually with any program of weight loss, once people start eating right and exercising, they actually, in the first few weeks, and I tell everybody this, you may gain some weight because you're gaining muscle first, and once you gain the muscle, then the fat starts to come off you. So there's almost a shift. Some people stay the same weight for 3-4 weeks, and I tell them, don't get frustrated. You're turning fat into muscle right now, and as soon as that reaches a critical point, then the fat's going to start to come off. So it's a good question. That's what happens.
And where can our listeners get more information about age management, your weight management, and your prolotherapy?
It's simple. Go to GenLife Regenerative Medicine, the website. It's a pretty complete website on all the data. We have a place, info@GenLifeMed, if they want to write us, email us, and we have someone who'll answer all their questions and whatnot. And we're happy to help people. That's what we're here for. We love helping people.
Thanks. You've been listening to Health Professional Radio. I'm your host, Neal Howard, in studio today with Dr. Charles Mahl, certified in age management medicine by the Synergetics Education and Research Foundation. He specializes, though, in the practice of regenerative medicine. It's been great having you here with us today, Charles.
Thanks a lot, Neal. Appreciate it. Had a great time.
Thank you. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm, and you can subscribe to this podcast on iTunes.